I meet different people with different educational backgrounds, some very educated people, and I've looked after them and actually reminded them to have a wash, which is something that takes you back when you're working with someone and thinking they are an architect as a professional, but today they can't even remember they haven't had breakfast.
Every single day there is a moment in my day when I feel like I'm doing something important, and I come home from work and without exception every single day there is something that I think I've made a difference or I've done something important. Sometimes those moments might be more than one in a day, sometimes it might just be something small in a day depending on what I'm doing, but that's the reason that I'm still in the job.
You don't just go in and it's just another day. You go in and often you don't know what you're going to be doing. You don't know quite how you're going to manage some of the challenges, but you do.
I think fundamentally it's a privilege to be a mental health nurse. The opportunity to work with people, their families, their carers, people who are going through really difficult times, work with them and I guess to give a sense of hope, optimism that things can get better and actually see them get better.
Being a mental health nurse has been very, very insightful for me because it gives me a deep understanding of how and why people tend to behave in a certain way that does not conform with the societal norm.
For me, it's the best job that I could do because it focuses on trying to understand people's experiences and be with them at really difficult times, and it's a privilege, I feel, you're part of somebody's life.
But at the heart of it all, it's just working with the patients day to day and enabling recovery, and that has been a consistent need of mine to be able to always be able to do something which I really think is helping support patients to recover so they can carry on and live their lives and have minimal interruptions from some of the more distressing parts of the mental health.
It's demanding at times, but when you see people get better, it can be really rewarding.
It's very, very, very interesting, and particularly for me, it's really, really insightful because mental health, understanding mental health disorder gives me very good insight into how human beings behave in real times, and then what sort of things could happen to make people not behave in the way the society will expect.
You will meet people who will astound you with their ability to keep going and keep making those small steps. And what we do as mental health nurses, we're just there alongside with them for the journey.
You work really closely when you're a mental health nurse with other professionals and other disciplines, so I'm constantly learning. There's something to learn all the time. I've been able to really develop my career and my role. I've done different things. I've worked in a prison, I've worked in inpatient settings. So it's a very varied role, and I don't feel like I've done anywhere near all of it yet. So it feels like there's more to do. I'm not sure I'd stay in a role if I felt that there wasn't more to do, but in mental health nursing there is so much to do, easily a career's worth.
A bit of a cheesy story, but my first couple of weeks at work, I remember leaving work after a late shift, so fairly late in the evening, and walking out the hospital gates and just going, I love my job, I love my job. And it was because something small that happened that shift, I'd managed to make a connection with somebody, and as trite as it may sound, you do get those moments of genuinely believing that you've made a difference, a positive difference in somebody's life.
You meet students every day, you meet people that have graduated in different degree with different levels of degrees every day, and they're in the same situation. And people that are not educated at all, but they're in the same situation and from different countries as well. And so you just realize that anything can happen to anybody at any time. So there's no need really to stigmatize mental health because we can all be there. And some people's lives changed just overnight.